So I'll start with a poem by Robert Frost. Two roads diverged in a yellow wood, and I could only take one of them. And I stood for as long as I could and peered down one of them till it bent in the undergrowth. So, what happens when you have to take the road less traveled? What happens when you have to take a leadership role during a period of extraordinary stress? So, I'm Dr. Muralidharan, Professor of Psychiatry and Medical Superintendent at the prestigious National Institute of Mental Health and Neurosciences, Bangalore. And I'm very happy to be here to share my experiences with you. A little bit about my institution. Okay, NIMHANS was set up in 1936 at the place where it currently stands near Dairy Circle. So in 1974, it became the National Institute of Mental Health and Neurosciences, and in 2012, it became an institute of national importance by an act of parliament, by a special act of parliament. So the vision of this institute has been to be a world leader in the area of mental health and neurosciences and to evolve state-of-the-art approaches to patient care through translational research. Now, in this institute, we see almost 7 lakh patients a year and have over 1,000 beds where patients get inpatient care. And we also have about 5,000 employees who are working at NIMHANS to provide care for patients. And it is in this institute that I work. So, I'm going to be talking about one particular epoch of mine. This is an epoch where ordinary people were put under extraordinary stress. And no, I'm not talking about your travel in Bangalore traffic. No, I'm talking about a different epoch, an epoch that is something common to all of us, the COVID-19 pandemic. So this was a period where ordinary people were put under extraordinary stress, isn't it? Yeah, so around April 2020, my director called me and said, you should take over as a medical superintendent in a few days from now. I was already working as a professor of psychiatry. I was serving as a deputy medical superintendent. I had done a course in hospital administration. Naturally, anybody given this offer would be very excited, and so was I. It was like a dream that was going to come true. But then, these were difficult times in April 2020, right? No one had seen a pandemic. I think most of the people who'd seen a pandemic were probably not alive. And let alone, leading a hospital through one. I was also advised by a lot of well-wishers that you're probably very young and junior to be taking such an important responsibility, so maybe you should not go for it. But I'm not one to let opportunities go by, and decided that I'm going to take this road less traveled. So I took over as the medical superintendent on the 8th of July, 2020. So having taken over, so what were the challenges that we faced, in terms of running the hospital? Normally itself, running a hospital is a big challenge, but during this period where a pandemic was going on, what kind of challenges, unique challenges did we face? First of all, for the patients, they couldn't access healthcare. They were all confined to their homes. All of you are familiar with the lockdown that happened. So nobody could leave their home. They had limited access to inpatient care. The outpatient services were closed in many areas, including our hospital, for a month or so. And the emergency services were overburdened, because a lot of patients were just coming in, getting treatment and going back. In terms of staff, like I said, this was a period where people were working under extraordinary stress. Normally, people in a hospital work under extraordinary stress, but here this was even more than that. And of course, we had to take care of our staff's mental health, make sure that they are protected, and ensure that there's no burnout that people suffer. And from the administrator's standpoint, we had to ensure that we keep up to date with whatever changes that were being announced by the government in terms of policy, and make sure that it is implemented at the ground level. So that was quite a stupendous task that was there for us. So how did we rise up to this challenge? So what happened was that there was a major paradigm shift in the way healthcare was provided, right? Now earlier, hospitals or mental hospitals specifically were places where patients were confined. But here you had a situation where the doctors were confined to the hospital and the patients were confined to their homes. So how do you bridge this gap between the doctor and patient? So that's where we had to leverage technology to bridge this gap between the doctor and patient. We had to make sure that patients could reach us and we could reach patients while not actually coming in contact with them. So we launched this helpline for mental health support, and you won't believe it that almost 6 lakh calls were registered, within a month or so of launching this helpline. And then we came up with this telemedicine. Telemedicine actually took wings during the COVID-19 period, and we used the internet facilities and various telemedicine softwares to reach patients in their home. So that's something that changed tremendously during this period. Also, we had to make sure that our staff were well looked after. So we came up with this, program where we had online yoga sessions and staff could attend these yoga sessions from home. Now, yoga is something that people do in a group, isn't it? Yeah, but we couldn't have people coming in contact with each other. So we came up with this session, and that was immensely helpful to a lot of our staff. One of the most important challenges during this entire epoch was that there was a lot of misinformation being spread, particularly about the severity of COVID-19. So we had to come up with a NIMHANS bulletin, which we published every week, giving information about what is happening, what is being done, and what measures are being taken to safeguard the patients and the staff. So these are some of the things that came up. And like I said earlier, our mission is to be a world leader in the area of mental health and neurosciences. So we also had to come up with some policies that was based on our practice at NIMHANS, which could be adopted by other hospitals in the country. So what were the leadership skills that actually helped me during this period? The most important thing would be to foster team spirit, right? So letting everybody know that, yes, we're all on the same side, we're all in this together. And together we have to face this crisis that's going on, a crisis that's dynamic, a crisis that's changing every day. And that was the most important thing for us to do. Delegating responsibilities and giving them the confidence that, yes, you can do this. So we gave one person the responsibility of vaccinating staff, one person the responsibility of handling the COVID care center for employees, say one person for taking care of patients who are coming to the hospital in terms of the emergency services. So micromanaging was not on, definitely not on, at least during that pandemic. So delegating responsibilities, giving them the confidence that, yes, you can do this and I will be there to support you. Handling criticism. This was a situation where, you're damned if you do, you're damned if you don't. But yes, criticism would always come from all quarters. But we would always remember that, these are the same people who are criticizing us are our own people, and it's our responsibility to see why they're criticizing us and see what can be done to handle the criticism. Right? And thinking out of the box, you'd be surprised that a lot of times there was no box. We were just thinking. Right? So thinking out of the box was something we had to do. I remember this one particular incident where we had to arrange a ventilator bed for one of our staff, and we couldn't find one in Bangalore. And then we found one in Mysore. So we decided to shift him all the way to Mysore just to make sure that he gets a ventilator bed. So sometimes we had to take decisions on the spot, think out of the box, and act to make sure that everybody were helped. More importantly, this was built on a foundation of trust. Trust in other people's abilities and confidence in my own abilities. So, was I confident at all times? Was I confident that I could handle this with the help of my team? No, not at all, not all the times, right? There were times when, I was going through these emotions of fear, right? What if I have to face a situation that is so rampant all around? What if something like that would happen to me or my loved ones, right? Now, we are in a hospital, we have to meet people. I can't avoid meeting people. A lot of people would come to my office, right? So that fear was there, but yes, at the back of my mind, there would always be this thought that, yes, I have to take this leadership role and I have to make sure that things happen. Self-doubt during a pandemic where situation was dynamic. You don't know if what you're doing is right or wrong, right? You don't know how it is going to impact someone else's life. So that self-doubt was always there. And then anger at times that things are not going our way, that things are not being given the way we want it to be. Sometimes with the rapid changes in policy that were happening, yes, it was there. Sometimes I would feel helpless, right? But come on, what's happening? Is this how things are going to be? But then we would always remind ourselves that this is just a phase. This will pass, and maybe things will get better in a few days' time. And there were many such cognitive biases that I had to handle, some emotions that I had to handle. So how did this, how was I able to handle this? Who were the people who helped me? I had to rely a lot on my social circle. Remember, I'm talking about social circle and not social media. I can see a lot of eyes lighting up when I said social circle. The social circle are those important people around you who play an important part of your life, right? So my family, my friends, they were very, very important to me during that period. And, they were the people I could talk to, share my deepest fears with them. And there would be a lot of reassurances that would come from them that would make me understand that, yes, I'm doing the right thing. Peers were a very important part of the social circle. You work with them, you spend a lot of time with them during the day. And we would discuss a lot of issues, we would discuss a lot of concerns and see how these could be handled. Sometimes it was my concerns, sometimes it was their concerns. And of course, I can't thank my seniors enough, the senior colleagues, right? We always look up to our elders when we are in trouble. We always look up to them for advice. And likewise, I had a lot of seniors who were advising me on what I need to do. They treated me with a lot of warmth and respect, and that is something that helped me in handling this crisis along with the team. So what worked for me during this epoch? Well, I already spoke about team spirit and trust. More importantly, my skills as a psychiatrist came in very handy. Having empathy, that is to be able to understand what another person is feeling or to understand the emotions of another person. So that's something that I could use, especially when I was handling people who were criticizing. Communication, again, is an important thing for a psychiatrist, and we always use communication to make sure that what we talk is clearly communicated and there's no ambiguity in what we speak. Patience, we have to have loads of it, because a lot of times the other person is just talking and we're spending a lot of time listening, but that comes in very handy when you're talking to people who are in distress. And of course, listening skills. It's not just hearing, but listening, making sure that the other person knows that you have paid attention to every word of what they said. So some of these skills actually came in very handy in that leadership role that I'd taken up. So while we were handling this pandemic, while we were handling a crisis, we also had to make sure that we didn't lose track of the vision of the institute, which is again to be a leader in the area of mental health and neurosciences. So what happened during this period was we also went in for our NABH accreditation. And we were one of the first hospitals from the central government to get NABH accreditation. So which means that not only was the team handling a crisis situation, we were also working towards ensuring that we get accredited by one of the bodies which certifies that we are providing the highest quality of care for our patients. And that was very, very important for us. During this period, we were also ranked among the top 200 hospitals in the world for 3 consecutive years by the Newsweek magazine. So all this was happening while this pandemic was raging and we were handling a crisis. And we also got the awards from the central government for sanitation and cleanliness in a government hospital. So these were important achievements that we did while we were handling this crisis. So what is my personal learning from this epoch and also my message to you? Sometimes dreams become reality. In my case, I don't know if I can call it a dream or a nightmare. Imagine having to lead a hospital in the middle of a pandemic. But yes, one of my dreams to be in a leadership role actually came true. And that was something that was immensely gratifying. You must also remember that whatever skills and knowledge you may have acquired through education must translate into action. That's when your leadership role actually becomes more meaningful. Start focusing on your strengths. You know what your strengths are. You know what your weaknesses are. Try and maximize your strengths. Try and minimize your weaknesses so that your performance, your productivity can be optimal. Focus on the process, not so much on the outcome. Right? I think that is most important. We don't really know what will happen at the end of a certain period of time, but you know what you can do right now to ensure that the outcome is favorable to you, and that is most important, right? Then again, when there are crisis situations, you have goalposts that are shifting every day, you have targets that are shifting every day. To be able to handle them with equanimity, I think that is something that is very, very important, and this is something that is going to be very helpful for all of you in future. And last but not the least, humility, right? I always remind myself that I am a leader, not a boss. It is my responsibility to take people along with me and not order them around. So to be humble when you are at the top is something that is extremely important. So to summarize what my epoch has been, over the last, the epoch that I was talking about, right? When the epoch started, at the beginning of the epoch, I didn't really know what will happen at the end of it. I didn't really know if I would become a goat or I would become a scapegoat, right? Yeah, but then I did take the courage and traveled on the road less traveled. I started with Robert Frost, so I'm going to conclude with this. I shall be telling this with a sigh, somewhere ages and ages hence. 2 roads diverged in a wood, and I took the road less traveled by, and that has made all the difference. Thank you so much, CIT, for this opportunity, and thank you so much for your attention. Jai Hind.